So we know that these sentiments may emerge. That's why we are wanting to reach out and assure Singaporeans that, look, we have in place a robust system. We have put in place measures as appropriate, and we will continue to monitor and do more if and when the situation escalates. It's a system that has multiple layers of defense. It's a robust system. But let's also be psychologically prepared. Right? It's important that people are psychologically prepared that this is not any system you put in place. Right? Given the nature of the virus, it will spread. We are trying to do our best to contain it and minimize the imported cases. But even at the start, we already forewarned and asked Singaporeans to be psychologically prepared that it would be a matter of time before we see the first imported case, which has happened. Given that we are a transport hub, given the nature of air travel today, it will spread to not just Singapore, but other countries that it has already done. So I think we ought to have that mindset, be prepared that this thing may worsen, but also have the assurance that if we continue to stay united, work together with the measures that the government has and will continue to put in place, with individuals taking social responsibility for their actions and their own health, we can overcome this crisis situation.
Can I just say something? Imagine at the height of SARS and we were affected quite badly. Imagine it at that time, other countries say, get Singaporeans out of our country, and we become a target as well, right? So we are international hub. We can well be quite hard hit by such epidemics. So I would say, do not do unto others what you don't want others to do unto you. I think we all must tackle the problem objectively and effectively.
I think it's important for us to ensure that our measures that we introduce are appropriate to the situation. And I also should remind all of us that each country's situation is very different. And so different countries may adopt different measures, but they all adopt measures that are appropriate to themselves. And we are monitoring the situation very closely to ensure that our measures are up to date, and we also take reference from recommendations and guidelines from the World Health Organization. So I think all these factors are taken into account when we decide on what measures to introduce. We have to guard against overreaction, and that will result in the more serious consequences. So I think it is important for us to always bear in mind that we must be appropriate to the current situation. And of course, as the situation evolves, we will need to continue to review and monitor carefully, and we may adjust our posture from time to time.